So, another common problem of the anterior femoral glide syndrome is tight hip flexor muscles.
Mhm.
These are located in the front of your hip. They are very deep. So, we're going to show you a way you can safely stretch these out. You're going to need to be on the edge of a bed. Hopefully, the edge of it is firm. Otherwise, you could certainly get on the dining room table if you feel comfortable doing that. You're going to start. Bring both knees to chest. The further my buttock is to the edge of the bed, the more stretch I am going to get. The closer I am here, the less stretching I'm going to feel. So you're going to slowly lower one leg down off the edge of the mat. Then I'm going to bend my knee back as far as I comfortably can. Make sure you bring the opposite knee up to your chest. You can see as soon as I do that, the tightness I have in my hip here. Feel a stretch. Hold this for 30 seconds. Breathe slowly. Then you're going to reset the back, both knees to chest, and perform on the opposite side. One thing to keep in mind, the leg that is down should be in a straight line. Do not have it go too far out. I like to do 3 sets of 30 seconds on each side, and just go to where you feel the stretch. Don't force it if you're starting to get a leg cramp.
Right. I do want to mention one thing to make it clear why we do this stretch the way we do. Go ahead and grab this knee. There we go. Let this one down. So when we do it with the knee extended or more straight, that gets the deep hip flexor up in the joint area. Now, when you allow the knee to flex, that gets a separate muscle, the rectus femoris, that actually connects at the hip and goes all the way down by the kneecap. That's another critical aspect of it. That's why this works when other people stretch and they don't have success. All right, the next important component is actually strengthening the hip, and make sure you strengthen the correct muscle. We're doing the hip abductor muscle. Mike is pointing at it now. Go ahead, Mike, go some details.
So this exercise, it's good to do it in front of a mirror if possible because you want to make sure your pelvis is level throughout it. So if I'm working my right leg, I'm going to stand on my left leg. I have a slight bend in my knee. I'm not locked out. And I'm going to simply kick sideways. Just go about a half an inch off the ground. I'm not going to do a full swing here. And we are going to keep our balance. I like to place my hands on my hips for beginners to see my pelvis is level. I'm not swaying hard like this. This is going to work the hip abductor on the leg swinging as well as the leg stabilizing. You're going to do 10 to 15 repetitions. Then you're going to perform on the other side. Now, this is the beginner variation. You want to be able to control it with just your body weight. Once this becomes easy, you can use a band like Brad will demonstrate here.
All right, a lot of people have these stretch bands. You simply stand on it. It does work better with shoes on than with stocking foot like I have here, but I want to show off my red socks. It is Christmassy right now. And simply do this. Now you can just increase resistance by pulling up on the band